All right, so this one is going to be talking about the anterior chest. So we're going to be working through pectoralis major, pec minor, serratus anterior, as well as subclavius. So when we're working in through the anterior chest, no matter who it is, we have to look at the tissue that we're working with. So we're going to create our safe borders so that we can palpate around the area properly and we have consent from our patient. So first thing I'm going to have my patient do is I'm going to have you take this hand and create a border on this side of the chest. And if your patient does have, or your body does have some extra tissue, I'm going to have you pull it to the opposite side. Great. And you're okay with me palpating everywhere above that hand?
Yeah.
Great. So getting consent for that as well. So pectoralis major. So pec major, we have two heads. We have our clavicular head, which is going to come from the medial clavicle, and we have our sternal head, which is going to come from the sternum and the costocartilages. So actually, we're going to start without the border. And are you okay if I palpate straight down your sternum? Okay. So I'm just going to come in and just show kind of our beginnings of the sternal head. So I'm going to come through the sternum, down, and it's going to get the costocartilages of 1 through 7. So it's going to go all the way down basically to the xiphoid process. So that's just showing our first border for the sternal head. Our second is going to come from the clavicular head, so the medial portion of the clavicle, and that's going to be our borders for pectoralis major, or our origins for pectoralis major. All right, if you could bring that border back. Okay, so now I'm going to be working around those areas. So I can palpate everything superior to that hand. Pec major starts off as a flat muscle, so I'm just going to flat hand down. Main actions here is we're going to get we're going to get flexion and adduction and medial rotation. So we kind of go in like this. So we're getting flexion at the arm, adduction, and we're getting a little bit of medial rotation. So I'm going to have her do this action for me. Okay, if you could do that. So I'm just firing off that muscle, feeling the tension under my hands and palpating out. Once I get around the axillary area, I can start to pick up the pectoral fold. So this is going to be pec major right here. And it's going to help lead me up to that lateral lip of the bicipital groove. So I'm going to have you do that action again. So hold that and resist. So I can pinch that muscle, pick it up, and it's going to lead me down to that lateral lip. So I come into the arm, find the bicipital groove, and then I'm going to be on the lateral side of that. That's going to be our ending points, our insertion for pec minor. So just flat hand down, pick up the muscle until you get to its insertion. Okay, pectoralis minor, you can relax for a sec. So pectoralis minor, this is going to come from ribs 3 through 5. There's a couple ways of palpating pectoralis minor. I prefer underneath pec major, so it's almost like we're doing subscapularis, but we're going opposite ways. So subscap, we came down towards the scapula. For pectoralis minor, we're going to come up along the ribs underneath the pec major. So you're not going to be able to see my hands for much longer, but I'll describe what we're doing. Okay, so my hands are along the anterior portion of the sternum. I'm going to slowly slide up and underneath pec major. Is that pressure okay? Until I find maybe the border of a muscle. I'm then going to have my body lift their shoulder up. So we're going to protract that shoulder forward. I'm just looking for a tensing against my fingertips. And relax. So I'm basically going from kind of mid-belly of that muscle, and then I'm going to work my way up towards the coracoid process underneath pec major. Okay, lift that shoulder again, and relax. And then one more time, and relax. So coming on top, I can find that coracoid process as well. We can try and palpate a little bit of pec minor through pec major, but it's going to be a lot of muscular tissue. So if I could have you lift your shoulder for me, so I can feel a little bit of the tensing there and just palpate down towards that coracoid process. Either way is okay. I just need to see you trying to get to that muscle belly and then leading as far down as you can towards the insertion at the coracoid process. Okay, subclavius. So subclavius is going to be our next one before we turn her over for serratus anterior. Subclavius is going to come from the first rib. So we're going to come up into between clavicle and first rib. So first rib is going to be a little bit underneath or connecting with the clavicle. So I want you to try and get into the junction between the clavicle and the first rib. This can be a tender area for people, so make sure that you're checking in. You're feeling okay? Okay. Just getting into that area. So between first rib and clavicle, what it does is when we breathe in, it's going to pull the clavicle and the rib together to expand the area for the lungs to open. So I'm gonna come into this area. I'm gonna have her take a couple deep breaths in and out from closer into the chest. So if you could breathe in and out for me. And all I'm looking for is for you to feel that movement between the rib and the clavicle. So some kind of tensing, some kind of pulling together of the two bony landmarks. And that's really it for subclavius. That's more of just like location. Okay, serratus anterior. If you could turn onto your side facing away from me, please. Okay, might be better over there. Okay, serratus anterior. So we're going to come from ribs 1 through 9, and then it's going to go up and attach onto the anterior surface of the medial border of the scapula. We're basically just going to go from the ribs and see how far up we can go. So finding the appropriate ribs. Is it okay if I palpate forward to your xiphoid? Yep. So I'm just gonna follow the edge of the ribs up to xiphoid process, because that's gonna be in line with rib 7. So I come out, so 7 down to 9, and then everything above that is going to be 1 through 5, or the rest that I need. So I'm just gonna lay my hands out, kind of like the serrated edge of serratus anterior. Just give her arm a break, so just lie forward. What I'm gonna have you do is push your shoulder forward for me. Great, so that's gonna be protraction, so that's what serratus anterior does. Okay, and again, and relax. So I'm just feeling that muscle belly tense under my hand. You're not gonna pick it up, you're just following the fibers. And again. Great, when I get up to here, I'm gonna change my fiber direction to head underneath the scapula. Okay, press forward again and relax. And right now it's almost like I'm going for subscapularis, but I'm keeping my fingers down towards the ribs. Okay, I'm just gonna let you hold that there. I'm gonna come behind and just pull at the medial border. Okay, and press forward. Okay, and relax. And this is as far as her body's going to let me go, but I can show that we're ending at that medial border on the opposite side. So just following the fiber direction up and then under as far as you can go. And that's gonna be serratus anterior. And that's it for the upper chest.